Have you ever wondered how medical billing works? Well, here's your chance to gain some insight. Medical billing is a crucial part of the healthcare system, serving as the communication bridge between healthcare providers and insurance companies. It's the process that ensures doctors, hospitals, and other healthcare providers are adequately compensated for the services they provide. Here's the gist. When you visit a healthcare provider, they document the services they provide. This record, often referred to as a claim, is then sent to your health insurance company. The insurance company reviews this claim, determines the portion they are responsible for, and then pays the healthcare provider accordingly. It's a complex process involving a mix of healthcare knowledge, attention to detail, and understanding of insurance policy nuances. Yet, it's an essential process that ensures the sustainability of the healthcare industry. So remember, medical billing, although complex, forms the backbone of the healthcare industry. Now, how does this process occur? What are the steps involved? Let's dive into the 8 essential steps that make up the medical billing process. First up is patient check-in. This is where the journey begins. When a patient arrives at the healthcare provider's office, their personal and insurance information is collected. This data forms the foundation for the entire billing process. It's like the first piece of a puzzle, without which the rest of the pieces just won't fit. Next is insurance eligibility verification. This is a crucial step where the provider's office checks whether the patient's insurance policy covers the services they're about to receive. Think of it as confirming your reservation at a restaurant. It's a way to ensure that everything goes smoothly when the bill arrives. The third step involves coding of diagnoses and services. In this stage, every diagnosis and service provided is translated into a universal medical code. It's like a secret language that healthcare providers and insurance companies use to understand each other. Then, we have the charge entry. This is where the cost of each service is added up. It's like a shopping list, but instead of groceries, it's medical services. The fifth step is claims transmission. This is where all the coded and costed information is sent to the insurance company. It's like mailing a letter, but instead of a pen pal, it's the insurance company. Next is payment posting. This is where payments from the insurance company are logged into the healthcare provider's system. Think of it as checking off items from your to-do list. The seventh step is follow-up on denied claims. If the insurance company denies a claim, the healthcare provider's office must investigate why and correct any issues. It's like a detective solving a mystery. Finally, the last step is patient billing for any remaining balance. This is where the patient pays for any services not covered by their insurance. It's like settling the bill after a meal at a restaurant. These 8 steps ensure that healthcare providers receive appropriate payment for their services. So, why is it crucial to get medical billing right? The answer lies in the very fabric of our healthcare system. Accurate medical billing is the backbone of the financial health of medical practices. It ensures that healthcare providers get paid correctly for the services they render, and no work goes uncompensated. But it's not just about the money. Accuracy in billing significantly reduces the chance of denied claims. Denied claims can mean a longer time to payment and can even result in no payment at all. This not only affects the financial stability of healthcare providers, but can also impact patients' trust in the system. Moreover, accurate billing helps maintain a positive relationship between providers and insurers. It promotes a sense of trust and mutual respect, which is fundamental for smooth operations. In short, inaccurate billing can lead to financial losses and strained relationships in the healthcare industry, so it's not just a good practice, it's a necessity. Let's see how much you've learned about medical billing. We've delved into this fascinating world where healthcare and finance intersect, exploring the ins and outs of the process. We've learned that medical billing is the bridge between healthcare providers and insurance companies, a vital mechanism that ensures the smooth flow of payments for services rendered. Remember, this process isn't a one-step journey. It's a complex dance involving several steps, each as important as the last. And accuracy, it's not just desirable, it's essential. Inaccurate billing can lead to a host of problems, from financial losses to legal complications. Now let's put that knowledge to the test with a quick quiz. First question, what is the primary purpose of medical billing? Second question, how many steps are involved in the medical billing process? And finally, why is accurate billing crucial in healthcare? Keep learning, keep growing, and remember, knowledge is the first step towards any change. Until next time.